A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a shocking turn of events, former President Joe Biden's recent cancer diagnosis has ignited a firestorm of speculation regarding his health during his time in office. Medical experts have indicated that Biden may have been living with prostate cancer for several years, raising questions about whether he and his team were transparent with the American public about his health. The diagnosis, confirmed by Biden's office, reveals that he has been diagnosed with an aggressive form of prostate cancer that has metastasized to his bones. This alarming news comes just days after the release of a new book that alleges a cover-up of Biden's declining physical and mental health during his presidency. The former president's diagnosis has drawn sharp criticism from his successor, Donald Trump, who expressed disbelief that the public was not informed sooner. Trump stated, "I'm surprised that the public wasn't notified a long time ago. Why did it take so long? This takes a long time. It can take years to get to this level of danger." His comments reflect a broader concern among some Republicans who are questioning the transparency of Biden's health disclosures. According to the statement from Biden's office, he was diagnosed after experiencing increasing urinary symptoms, prompting further medical evaluation. Doctors rated his cancer using the Gleason classification system, assigning it a score of 9, which categorizes it as one of the most aggressive forms of prostate cancer. With late-stage prostate cancer typically having a 5-year survival rate of just 28%, the diagnosis has understandably sent shockwaves through the political landscape. In a show of gratitude, Biden took to social media to thank his supporters for their encouragement, stating, "Cancer touches us all. Like so many of you, Jill and I have learned that we are strongest in the broken places. Thank you for lifting us up with love and support." This heartfelt message came amidst growing scrutiny regarding his health and the implications of his diagnosis. The timing of Biden's diagnosis has raised eyebrows, particularly with the recent release of the book, Original Sin, by CNN anchor Jake Tapper and Axios correspondent Alex Thompson. The book contains allegations that Biden's inner circle concealed evidence of his cognitive decline during his presidency. One particularly troubling anecdote describes an incident in which Biden reportedly failed to recognize actor George Clooney at a fundraising event in 2024. Trump seized on this connection, stating, "If you take a look, it's the same doctor that said Joe was cognitively fine. There was nothing wrong with him. There are things going on that the public wasn't informed of, and I think somebody is going to have to speak to his doctor." This assertion has fueled further speculation about the integrity of Biden's medical evaluations while he was in office. Medical professionals have weighed in on the implications of Biden's diagnosis, with some questioning the timeline presented by his office. Dr. Stephen Quay, a pathologist and CEO of Atossa Therapeutics, noted that advanced prostate cancer typically takes 5 to 7 years to progress to a metastatic stage without treatment. He stated, "It would be malpractice for this patient to show up and be first diagnosed with metastatic disease in May 2025. It is highly likely he was carrying a diagnosis of prostate cancer throughout his White House tenure, and the American people were uninformed." Similarly, Dr. Howard P. Foreman, a radiology professor at Yale University, expressed disbelief that Biden's cancer would not have been detected before leaving office. He emphasized that a blood test known as the prostate-specific antigen (PSA) test would have revealed elevated levels long before the recent diagnosis. Leeson grade 9 would have had an elevated PSA level for some time before this diagnosis, and he must have had a PSA test numerous times before. "This is odd," Foreman remarked. However, there are differing opinions among medical experts regarding the screening protocols for prostate cancer. Dr. Daniel W. Lin, a prostate cancer expert at UW Medicine, acknowledged that while it seems likely Biden had cancer for years, it is possible he was not given regular PSA tests due to differing medical guidelines regarding screening for older patients. There are screening controversies with the use of PSA, and many medical groups do not recommend PSA testing after 70 or 75 years of age, Lin explained. As Biden's health continues to be a focal point of discussion, the political implications of his diagnosis are becoming increasingly apparent. With the 2024 presidential election on the horizon, questions about the former president's fitness for office and the transparency of his health disclosures are likely to dominate political discourse. In the meantime, Biden's supporters are rallying around him, providing an outpouring of love and encouragement as he navigates this challenging chapter in his life. The coming weeks and months will undoubtedly reveal more about the implications of his diagnosis and the political fallout that may ensue. As the nation watches closely, the intersection of health, politics, and public trust remains a critical area of concern for many Americans. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.